I'm Erica Kaufman-West, Director of Infectious Diseases at the American Medical Association. Sepsis is a leading cause of hospitalization and hospital mortality, contributing to over a third of all hospital deaths. In the United States, there are an estimated 1.7 million adult sepsis hospitalizations annually, of which 350,000 result in hospital death or discharge to hospice. Despite the burden of sepsis and the importance of early treatment, community knowledge of sepsis remains low. The CDC's Hospital Sepsis Program core elements is for clinicians, hospitals, and health systems leading efforts to reduce incidence of and negative outcomes from sepsis. There is no single template for a hospital sepsis program. However, sepsis programs can be implemented effectively in a wide variety of hospitals and healthcare systems, and this guidance lays out key features of effective programs. To help guide you, the AMA and CDC partnered on a webinar series explaining each of the core elements. This video contains all of the presentations from the CDC experts who crafted the core elements and from doctors and nurses implementing them in the field. Click the link in the description to view full recordings of each session, including audience Q&A, and to claim continuing education credit.
On this slide, we share results from a Morbidity and Mortality Weekly Report that was published over the summer that provided information on the current state of hospital sepsis programs throughout the country. We learned that 73% of hospitals currently have a committee that is tasked with addressing sepsis. But when we dig deeper into the composition and activities of these committees, we find that there is further opportunity for improvement. For example, we found that only 55% of hospitals provide any sort of dedicated time to the individual or individuals who are leading the sepsis program. We also found that only 55% of hospital sepsis programs have collaboration or coordination with hospital antimicrobial stewardship programs. So we think that there is work to be done in terms of ensuring hospital sepsis programs throughout all hospitals, and also in terms of strengthening the structure of the hospital sepsis program activities. Next slide, please. And so the purpose of the Hospital Sepsis Program core elements is to provide guidance for monitoring and optimizing the hospital management and outcomes of sepsis. Essentially, this is a manager's guide of how to build a successful hospital sepsis program, and we provide emphasis on leadership support, so hospital leadership support of the sepsis program, ensuring the necessary personnel, resources are available to the sepsis program to carry out its work, and then also use of quality improvement tools and implementation science to ensure the best translation of the sepsis program work. This guidance is really meant to complement existing sepsis guidelines and facilitate the implementation of recommended practices in evidence-based guidelines. One key distinction from prior initiatives related to sepsis is that the core elements really focuses broadly from very first recognition all the way through hospital discharge and recovery, whereas many prior initiatives have really focused on these kind of first 6 hours or golden hours in the management of sepsis. And of course, those are critically important and are in a focus of the core elements, but there's also a broader focus to the core elements. The core elements are intended to be applicable to all U.S. hospitals and hospital systems, and there is flexibility built into them. We recognize that one size will not fit all, but the guidance should be broadly applicable regardless of setting, and also for hospitals just getting started with developing a sepsis program, as well as for further strengthening sepsis programs that have been in existence for many years. Next slide. The core elements include several documents. So on the left hand, there is the core elements document itself. This is the guidance that walks through each of the core elements, provides the rationale, and provides examples. Also included is a hospital self-assessment tool. So this allows you to go through and evaluate the current state of affairs at your hospital, and then identify areas for next steps in terms of getting started to build your program or to further strengthen your program. Additionally, on the right-hand side, we have an overview graphic that provides a high-level summary of the 7 core elements. Next slide. So here I'll walk through the 7 core elements. The first is the hospital leadership commitment. This is having engagement and buy-in from hospital leadership and recognizing sepsis as a priority at your hospital and healthcare system. Accountability has 2 pieces to it. The first is identifying a specific or 2 specific leaders to guide the sepsis program and to be responsible for its day-to-day activities and outcomes. And then also to set concrete goals for the hospital sepsis program and to evaluate progress towards those goals and to update those periodically, such as annually. Multiprofessional expertise recognizes that sepsis is a program or a condition that absolutely requires multiprofessional expertise. And so we lay out who we think are key individuals to engage in hospital sepsis work. Action refers to the structures and processes at your hospital to help support the implementation of recommended best practices. Tracking and reporting go hand in hand and refer to monitoring, management, and outcomes of sepsis at your hospital and reporting that information back to key stakeholders within your hospital. And then education speaks to education of clinicians, healthcare staff, patients, families, and caregivers.